Seniors on Social Security and disability benefits are struggling. Majority of them have been forced to cut back. And this is coming from this breaking news that just was reported yesterday. But here's the thing, the government is saying that everything is okay. We see the latest inflation numbers that the government released. It shows that inflation continues to go down. So why are seniors experiencing financial stress? Why are majority of seniors cutting back on spending? Why are a lot of seniors struggling on a monthly basis to make their social security check go far? And I have done the research and I've identified 3 reasons why seniors have been struggling the last couple of years. One of them is this, and I'll put this on the screen. Since 2010, social security checks have not kept up with inflation. And that is what the government is not telling you. So if you look at this graph, you will see that the blue one is real inflation that the government has reported. And then the red one is inflation that seniors are actually feeling. There is a big gap. And it got worse in the 2020s because you can see that red gap went all the way up. So if you're wondering why you cannot make ends meet, if you're wondering why your social security and disability check is not going far, this is the reason why. So what is the solution? Well, there's only one solution to this problem, and that is for seniors to get a social security increase. But the thing is that politicians have been talking about social security increase all year, and nothing meaningful has happened, especially for seniors on low income. So I am going to share with you 3 bills that are currently in Congress that have realistic chance of getting passed this year to give seniors an increase. Now, I am not talking about a pie in the sky idea. I'm talking about actual bills that I'm going to show you and what they contain. One of them is going to give a certain group of Social Security recipients $660 increase. Another is going to give a $200 increase across the board to everybody on Social Security and disability. So stay tuned with me. There's a lot I want to cover with you. My name is Kwame Kwade. I am a government benefit expert. For 15 years, I've been helping seniors get the retirement benefits they deserve. I create content on Social Security, Medicare, Medicaid, food stamps, and other personal finance issues that affect seniors both in and out of Congress. If you are new to my channel, welcome. Please do me a favor, go into the comment section and let me know your city and your state, because I like to know where you guys are watching this broadcast from. And if you've been watching my channel for a while, welcome back. I am glad you're here. We have a lot to cover. And so let me go to the headline that got me down this path of doing the research to understand better what is happening with seniors when it comes to Social Security and how seniors are struggling. So the headline, let me make sure that you can see it on my screen. Here we go. So here it is. I will have to remove this and then add that. Okay. It says Social Security checks aren't keeping up. Majority of retirees fought to cut back. And that is not the only headline that is saying this. I'm going to share a few more with you because this is something that is becoming a growing trend that a lot of reporters are noticing, that seniors are struggling. And so they've been reporting it in the news, and I've been picking up on this news coverage. And so I'm going to share another one with you. Here it is. It says Social Security recipients struggle. Nearly 1/3 cut back on essentials amid rising costs. So they are saying that the reason is that cost is rising. It means that inflation is continuing to affect seniors in a disproportionate way. But the government is saying that that is not the case because inflation is down. They're saying it's at 2.9%. So here's the thing. In 2026, they are even so confident that inflation is down that your cost of living adjustment, COLA, that you've been waiting for is going to be very disappointing to a lot of seniors. And let me show you what that looks like. And I can tell you what can be done to fix it. So of course, seniors have been waiting for a cost of living adjustment all year. And according to the very trusted source, the Senior Citizens League, cost of living adjustment is going to be 2.7%. That is what they are estimating for 2026. Meanwhile, the government is telling you that inflation is at 2.9%. So the government is saying inflation is at 2.9, but your cost of living adjustment is going to be at 2.7. So there lies some of the problem, because as I have shown you in this graph, the earlier graph, Social Security increases have not kept up with inflation since 2010. And in fact, according to this same report, seniors on Social Security are owed $370 because of what's happening on this screen. Because if they look at 2010 on what the actual inflation is and what your cost of living adjustment has been, seniors need to get an adjustment of $370 to catch you up to where you need to be right now. But that's a whole separate topic. So let's stay focused on what I wanted to share with you today, which is that there is a disconnect between what the government is saying and what seniors are actually experiencing. And I've shown you a couple of articles that is highlighting why seniors are struggling. So I told you the first reason is that seniors are experiencing inflation that is not being reflected in how the government calculates your cost of living adjustment. The second reason is that if you look at the cuts that are being made to programs that seniors care about, a disproportionate amount of that is affecting seniors. And again, I have the receipts. I want to show you what I mean. So let's talk about food stamps, for example. This article shows that seniors living in these 15 states could be hit hard by food stamps because to pay for the big, beautiful bill, Congress did cut a lot of money from food stamps program. So let's read this together. It says President Trump, hold on, let me make sure you can see it. Okay, good. So the article says that President Trump's big, beautiful bill made several changes to the SNAP program. These changes are likely to reduce some seniors' benefits or render them ineligible for these benefits. It may be a year or two before Americans can feel the full extent, but right now seniors are already feeling the effects of food stamp cuts. So what does this mean? Well, some states are going to be hit harder than others. So President Trump's big, beautiful bill, which passed in July, has made changes to the food stamps program, and these states are expected to have the biggest impact. So in New Mexico, 21.3% of residents are on food stamps. And now the state is going to be made to pay more, and so they're going to drop more people from the program. Louisiana, 18.5% of people are on food stamps. Oregon, 17.9%. Oklahoma, 16.9%. Massachusetts, 15.9%, and so forth and so on. So all these states that you see on this list, the 15 states you see on this list, are the hardest that are going to be hit by the food stamp changes in the big, beautiful bill. West Virginia, Pennsylvania, Illinois, New York, Alabama, Michigan, California, Florida, Rhode Island. And these states have high percentage of their population on food stamps and are also going to experience some of the biggest cuts to the program. So if you live in those states and you're a senior citizen, this is one more thing you have to worry about. But it does not end there. And as I said, I am not just here telling you what is wrong. I am going to tell you what is going to be done or what is being proposed to fix it. And so let's look at Medicaid. Medicaid is another area that seniors are going to see some impact. So this is from the KFF, Kaiser Family Foundation, one of the most reputable, organizations that talk about healthcare issues. And they are showing here, and let me make sure I can put this on the screen fully. So they are showing the impact of the big, beautiful cuts to seniors. So it says potential federal Medicaid cuts are equivalent to Medicaid spending for 18% of seniors and people with disability, 38% of adults, or 76% of children. So on the left-hand side, you can see 3 million seniors are going to be impacted, 14 million adults are going to be impacted, and 22 million children are going to be impacted. So that is another source of stress. And so what can be done? Well, here is the thing. We can say that there is a problem, but unless Congress does something to change the situation, then we're still going to be experiencing this problem. And the only solution to fix this, especially since we know that seniors are owed $370 from the fact that inflation and cost of living adjustment have not kept up with each other. It means that seniors have been cheated out of their cost of living adjustment, and the social security and disability benefits that you're getting right now does not truly reflect the cost of living realities that seniors face. On top of that, next year, Medicare Part B premium is going to go up by a larger amount than predicted. So if you want to look at how you can make sense of the social security increase you're going to get, let's look at how Medicare is going to affect your check. So again, I'm going to go to, because I brought all the receipts, I'm going to go to this article from the AARP and then show you what Medicare Part B premiums are expected to be. So the AARP was reporting that Medicare Part B premiums are going to top $200 and it's going to be a 12.6% increase. So here lies all the confusion about why I am so passionate about what's going on. And I want to make sure that you have the information so you understand why you feel the way you feel. And if you feel like you can never get ahead, there is a reason why. The first reason is that the government says inflation is down, but you don't feel it because cost keeps going up. The second reason is that Social Security increases has not kept up with inflation since 2010. The third reason I've given you is cuts to Medicaid, to food stamps that is going to impact seniors disproportionately. But another reason is that costs that affect seniors are also on the increase. And one of those is Medicare Part B premium. Because those are taken out of your Social Security check right away, it's going to go up by 12.6%. So how can the government say you're going to get a 2.7% increase when inflation for August is 2.9%? And then how can the government say that you're going to get a 2.7% Social Security increase when your Medicare Part B premium is going to go up by 12.6%? So the same government is pretty much speaking from the two sides of their mouth because they're saying, yeah, inflation is down, so we're not going to give you a big Social Security increase. But then the same government is saying, well, but you have to pay a 12.6% increase in your Medicare premium, which is then going to take away a big chunk of your Social Security increase. And that is why seniors continue to feel they cannot get ahead. So there are three different proposals to increase or put money in the pocket of seniors that have been proposed that are actually bills I can share with you. So now that I've highlighted what the problem looks like, let's talk about the solution. So the first thing I want to share is the President Trump supported an idea to send everybody a $600 rebate check. And then there are two proposals in Congress to give seniors a $660 increase for certain groups of Social Security recipients and a $200 increase across the board. And number three, fix how cost of living adjustment is calculated so that $370 hole I've been talking about, it doesn't continue to grow. So those are the actually four things that are in progress, and I want to explain that to you. The first one is the $600 rebate check. So this is something that President Trump has supported, and the senator from Missouri, Josh Hawley, actually then wrote the legislation to make it happen. And so let's read it together. So if I can pull this on my screen. Okay, here we go. So as you can see, it says Hawley introduces legislation to send rebate checks to working Americans. And essentially what it's doing is that it is taking money from what has been received from tariff revenue and giving some of that back to everybody. It's kind of like going to work like the stimulus check you got during the pandemic. And it says that exactly. It says Americans Worker Rebate Act would provide a tariff rebate check this year, not next year, not 2026. It says 2025. This year, to American workers and families with similar parameters to the direct payments passed by Congress in 2020. Ensure the amount of the rebate is at least $600 per child, dependent child, and per adult. So adults are going to get it, children are going to get it. If you're in a family of 4, a family of 5 will get, 600 times 5, 3,000. So if you're a family of 5, you're going to get 3,000. A family of 4, you're going to get 2,400. If you're a family of 2, you're going to get 1,200. Everybody, Social Security, disability, it doesn't matter. Everybody gets the $600 check. And if more tariff revenue comes in, that money is going to go up. Now, I told you I came with receipts, so I'm going to show you the exact bill that Senator Hawley has introduced in Congress to make this happen. Because as I said, I'm not talking about things that may happen. I'm talking about things that are in motion to happen. So that's the bill. It says in the 119th Congress to amend the Internal Revenue Code of 1986 to provide rebate to Americans using tariff proceeds in the Senate of the United States. So that is the first bill. The second bill is one of my favorite and hopeful bills that I've been talking about that I cannot stop talking about because I know that it is the bill that will bring the biggest relief to seniors. So that bill is called the Social Security Expansion Act. And I will share with you the actual bill, and then I will share with you what's in the bill. So let me find the screen to that. Okay, here we go. So this bill, it's also in the 119th Congress, which is the Congress that is currently in session. And there is a version of it in the House and the Senate. And the why I'm hopeful about this bill is that it has bipartisan support. So you have Democrats and Republicans who are supporting this to make it happen. So you can see it says the bill number is S.770, the Social Security Expansion Act in the 119th Congress, which is the 2025-2026 Congress. And then the text, you can see this is the entire bill. And I'm not going to bore you with it, but it's all in here. And everything I'm about to speak to is condensed version. It's a summary of what is in the bill that I just showed you. So you're probably thinking, how is that going to benefit you? Well, let me tell you. So I was able to get my hands on a summary of the bill that highlights the essential parts that seniors should care about. And so here we go. So the biggest part of this is I told you that seniors are owed $370. Well, one of the things that are in this bill that I think is going to be helpful in helping seniors make up some of that $370 is the across the board $2,400 increase. So in this bill, the section that I've highlighted is going to give seniors a $2,400 increase across the board. That translates into $200 a month increase. So whatever Social Security benefits you're getting right now, add $200 a month to it. That is what the bill wants to do. So if you're getting $1,000, your check is going to go to $1,200. So that's the first thing across the board. Social Security, disability benefits, everybody gets. The second thing is addressing a problem that have plagued the Social Security program for a long time, which is poverty among seniors. Why are so many seniors living in poverty, even though they've paid into Social Security for 30, 40, 50 years? Well, part of the reason is twofold. One, if you worked in a low-wage job and did not pay a lot of money to Social Security, your Social Security check is going to be low. So that's reason number one. Reason number two, there are people who took time out of work to raise children, and so they end up getting a small check because Social Security is looking at 35 years of your most active employment years. And so if you stayed home, all those years that you stayed home, there's going to be zeros in those columns. So when they average everything, your average is going to be lower. And a lot of people are in that category. So to solve this problem, this bill is going to increase what they call the special minimum benefit. The special minimum benefit is the government, way of trying to fix the problem, but doing a poor job of it, because there are some people who get Social Security checks that are so low that the government puts you at a minimum. that everybody has to get. But that minimum check, it still puts a lot of people in poverty. And so in this bill, it says that it's going to improve the special minimum benefit for Social Security recipients. It will help low-income workers stay out of poverty by increasing the special minimum benefit and indexing. That's the most important part. Indexing the benefit to the level that is equal to 125% of the federal poverty line, or over 18,000. Well, in 2025, the federal poverty line at 125% is more than 18,000. It's actually 19,500. So I'll show you what that looks like so that you can see that once this bill passes, anybody getting less than $1,300 in Social Security benefit is going to see about a $660 increase, because 125% of the federal poverty level for one person is 19,562 for 2025. So that is how much your benefit is going to increase if you are getting the minimum benefit or you're barely getting anything. That's what's going to happen. The third thing the bill is going to do is fix how cost of living adjustments are calculated. Remember, I was saying that you are owed $370 because the government has not paid you realistically what seniors are facing in terms of inflation. Well, this bill is going to fix that, and it's going to create a new formula to calculate Social Security cost of living adjustment. So I hope that I've been able to explain this in a way that, makes you understand why you're feeling that you can never get ahead, or while a lot of seniors are struggling and are cutting back, and the government is telling you one thing, but you're feeling something different, and you may be feeling like, am I crazy? No, you're not crazy. It's because what you're feeling is true. Seniors are experiencing cost that is not being reflected in your Social Security increase. So the next thing I want to talk about is Medicare. Now, we're almost at the open enrollment season, and here is a promise I have made, and I've been talking about it the last couple of days. I am on a mission to help 100,000 seniors get peace of mind about Medicare. And you're probably thinking, why is that important? Why do seniors need peace of mind about Medicare? Well, the thing is that a lot of seniors are struggling to really make sense of the Medicare program, something you've earned, you've paid into it, and you've earned that right to get proper care. But the government is not going to just hand you a great Medicare program because they are generous. It is your responsibility to go through the 24,000 Medicare plans that are out there and find one that fits your budget, the kind of care that you need, the hospital networks that you need to be in, the doctors that you need to be seeing, the prescription drug coverage you need, and so forth and so on. And so as a result, 90% of all seniors are in the wrong Medicare plan, and it's costing you money. It may be costing you your health. And so what I'm trying to do is educate you around Medicare, create guides, and share it with you so that you can get the information you need to make an informed decision, and then connect you with the best Medicare resources and support out there. So here's the thing. You look at the news, and Medicare is changing constantly. Not a day goes by without us seeing a plan dropping seniors from Medicare programs, hospitals that are dropping Medicare Advantage plans. You have rural hospitals that are struggling and are cutting back. Here is another article. 1 million patients lose coverage to insurance. Hospitals drop Medicare Advantage. 10 big Medicare changes coming, including premium increases, drug price drops. I mean, there's so much in the news that it causes a lot of seniors to stress about Medicare. And so where is that peace of mind going to come from? Well, you need an advisor, a Medicare advisory company that is in your corner. That is not there to sell you anything. They are there to help you figure this out and get that peace of mind that I'm talking about, which means that they put you in the program that fits your needs, and it's not something that is going to make them more money. And if you think that does not happen, the Trump administration sued a whole bunch of Medicare advisory companies for misleading seniors and putting them in programs, Medicare programs that they did not need or does not meet their needs. So that is happening. And that's why we're partnering with Chapter Medicare, because Chapter was, number one, not one of those companies. Number two, they are there not to sell you anything. They are there to be in your corner. So to prove to you that we really take this seriously, over 2,000 of our viewers have already worked with Chapter to get that peace of mind about Medicare that I'm talking about. So you too, today, can achieve that. So call the number you see, 539-205-2147, or go to askchapter.org/insider. I'm going to put the link in the comments and in the description to this video. And here's the thing. These guys are not there to sell you anything. When you call them, this is what's going to happen. They're going to look at the plan that you're on. And if you're in the right plan, they'll tell you. And if you're among the 90% of seniors that are in the wrong Medicare plan, they're going to show you Medicare plans that fit what you need. So you're going to tell them that your budget, the kind of, hospital networks that you need to be in, the doctors that you need to see, the prescription drug coverage you need, and they're going to take all that into consideration and present to you plans that fit your needs and also are local to you, because some of Medicare Advantage plans are state specific, but they have access to all 24,000 plans, so they can tell you what is available to you, and then you can make an informed decision with all the information. Now, these are the guys you're going to be talking to. I went to their website and pulled all these photos of their licensed agents that are waiting for your call. And here's the thing. If you don't want to fill out, call them, you can fill out the form. I'm going to drop the link in the comments and in the description. Now, I told you I did my research. They are A+ rated with the Better Business Bureau. They can save you $1,100 on average. And I just talked to you about seniors cutting back. $1,100 a year back in your pocket is going to do a lot. And we have tons of 5-star reviews from people who've worked with them based on our recommendation and have had great experiences. So there's no downside to this. We're about to enter an open enrollment period. You need to be in the right Medicare plan, get that peace of mind I'm talking about, and Chapter is that solution. So give them a call today. And here's the last thing I want to share with you. I have been working on something that I've been announcing recently that I am excited about, and I think a lot of seniors who have signed up already are excited about. So here is your chance to, have the opportunity to join this amazing community that we have created. So over the last couple of weeks, I've been sharing, if you've been watching my channel, that we created a community exclusively for seniors. And you're probably thinking, why? Well, here's the thing. Even if you're watching my channel consistently on YouTube, YouTube does not show you everything. And second, I am not able to cover everything that I want to cover here on YouTube because there's so much. And so the idea is to have a community where exclusively for seniors that you can be a part of. And the goal is to help you to stop missing out on retirement perks and benefits that you deserve, and to minimize your stress about retirement and maximize your retirement so that you can get the help that you deserve. And so it is on the school platform. It is a community that's going to help you unlock every dollar, every discount, every advantage from Social Security, Medicare, Medicaid, and more. But here's the thing. What are you going to get by joining today? Well, exclusive weekly videos on how to maximize Social Security, Medicare, and your personal finances, monthly money saving tips and senior discounts, step-by-step resource guides for benefits and programs, live Q&A sessions with experts, including myself and my team, and above all, a supportive community of seniors who are going the same way you're going, heading the same direction, want the same things, want to be seen, heard, appreciated, but also get their questions answered in a safe environment where they feel like their question is being heard and getting answers directly to them. So here is how it's been working. I've been popping in there every day and answering questions, but also sharing resources. So you can see this Q&A video that I posted recently. Another thing that we did recently was, I every now and then I'll pop in there and you can ask me anything. And then I will take my time and research your question and then give you an answer that is specific to you. So, for example, this person asked me something about Social Security work requirement. I did the research and answered her directly. That is the kind of one-on-one attention you're going to get as part of this community. And if there's breaking news, you'll be the first to hear it because I'll record a video and put it exclusively in that community. And then one of the best things, the best perks you get is all our paid guides. If you've been following us for a while, you know we release some of the best Social Security benefit guides. We release all these personal finance guides that we are selling on our YouTube store. You get all of them for free starting today. There's about 16 of them out there right now, and they cover a wide range. For example, 10 proven ways for seniors to make extra money, $500 to $1,000 a month. A lot of seniors want to get part-time jobs, but they don't know where to look, or they are frustrated that their search is not yielding the right results. This guide is going to walk you through that, what to look for and where to look. Social Security changes. We're about to release the 2026 version, so you'll get that for free. AI. If you've been curious about AI, but you're worried or you feel like, you know, you're shy to ask the question about how you can use AI to improve your life, this guide will tell you where to look and how. And then there's more secrets to boosting your Social Security benefits. Senior banking. This is one of the biggest guides we have. All the essential value about how to maximize your banking experience, best CD rates, senior specific perks, fee-free checking accounts for seniors over 55 and more. A complete seniors guide to Trump's big beautiful bill. If you've been confused about that gigantic bill, this guide will tell you what you need to know. And then the best senior discount guide out there. If you've been missing out on senior discounts or you don't even know what you don't know, this guide will tell you, and so forth and so on. Medicare cheat sheets. And we have all these templates that can help you. For example, we've been encouraging seniors to save $10 a month, a week, so they can have $500 saved at the end of the month. And this 15-minute guide will tell you what to do and how to find the $10 in your budget. So guys, I know I've been talking a lot, but I wanted to make sure that you see what this community looks like and how seniors are getting value. So this is the inside of that community. When you sign up, this is what you're going to see: a 30-day challenge that we did recently, a recipe swap, Social Security content, Medicare content, Q&A. You can ask me anything and so forth. So this is what the inside looks like. And this is the experience you're going to get when you join. So how do you join? Go to school.com/benefits insider, or you will see the description, the link in our description to this video. And I'm going to pin it also to the comments. You will not be disappointed because all the guides that I've shown you are going to be available to you right now, the moment you sign up, and you can start getting about $2,500 in value, discounts, and perks just by signing up. So do not delay. Check it out. And if you like what you heard today, if you like the content I presented, hit the like button, hit the subscribe button, and I'll see you tomorrow.